So good afternoon, everyone. My name is Chris Asplin, and I am the Executive Director of the National Criminal Justice Association. We here at NCJA certainly hope that you and yours are all safe and well at this time. And we hope in particular that those folks in the parts of the country that are experiencing a surge in the coronavirus issues, we think of you all especially at this time. But again, we hope all are safe and well. It's my pleasure to welcome you to our webinar today on supervision technology. This is really the second webinar in a series on technology and the coronavirus. First was on court technologies, and that is available on our website. Watch your inbox for future webinars on the website. But I also want to start off by kind of giving a shout out to TrackTech, who is a great partner of ours, a sponsor of our forum, and it was really through conversations with the folks at TrackTech about the value of supervision technologies and the utilization of supervision technologies, particularly in the context of early release, et cetera, as a result of coronavirus, that we decided to put this webinar together. So again, thanks to the folks at TrackTech for your help in that regard. Before we go over, let me kind of go over a few logistical items. The regular rules apply. First, we'll be recording today's session. The recording and the slides from this session will be emailed to everyone who registered, as well as posted to the NCJA website. Due to the number of people joining us today, we have muted all of the participants to reduce background noise. If you have questions, we encourage you to submit them using the question and answer box at the bottom of the screen. We've included time for question and answer period at the end of the presentation. So if your question doesn't get answered as part of the main presentation, we'll try to answer it during the Q&A. However, you can certainly submit your question at any time. If you'd like to communicate with NCJA staff during the webinar, please submit the comment using your chat feature. Finally, at the end of the session, we'll be launching a short poll. We encourage you to fill this out to help us continue to improve our webinar offerings. So let me start off by briefly introducing our speakers today who have been kind enough to join us and add their expertise to our discussion. Joe Russo is program manager with the University of Denver, where he has supported a variety of National Institute of Justice funded initiatives. His work is focused on the identification of high priority technology needs for corrections professionals and managing projects to provide these professionals with better information and tools to perform their important mission. Prior to joining DU, Mr. Russo served both the New York City Police Department, the New York City Department of Probation and the New York City Department of Corrections. Mr. Russo is active in a number of national associations. He was recently elected to the position of Secretary of the American Probation and Parole Association. Elisa Lopez Canseco has been employed with CrossPoint for approximately 22 years. She began her career with the agency in October of 1997 as a caseworker aide at the female facility. Prior house and after serving in different positions, including case manager and unit manager, she was ultimately promoted to program administrator. As program administrator, she's currently responsible for planning, directing, coordinating, and monitoring the day-to-day operations of the Federal Bureau of Prisons program, facilities, and the personnel issues at 2 CrossPoint residential reentry centers. She holds a master's degree in public administration and a bachelor's degree in psychology from the University of Texas at San Antonio. She's a Northside Chamber of Commerce Leadership Lab 2013 graduate, current member of the International Community of Corrections Association Board and Public Policy Committee, and is the ICCA president-elect. So again, thank you to Lisa and Joe for being here. What I'd like to do now is to give kind of a brief, emphasis on brief overview of CESF funding, which is really the genesis of today's webinar. And again, this is one in a series of webinars that we've had. But I recognize that there are some folks on the phone or on the webinar today who have heard this presentation many times in the context of other issues regarding COVID and the utilization of CESF funds. But in looking through the registration, I see that there are some folks that are completely new. So I'm going to try to walk that fine line for a few minutes to not be too repetitive, but also to make sure that new folks have a good understanding of what it is that we're talking about and what brings us here. So you're all familiar probably with the CARES Act, which was passed by Congress this year. And as part of the CARES Act, the CESF, the Coronavirus Emergency Supplemental Funding Program, was instituted. Now that program provided $850 million specifically for criminal justice and law enforcement applications, specifically to, quote unquote, prevent, prepare for, and respond to coronavirus domestically or internationally. And those three elements are really important: prevent, prepare for, and respond to coronavirus. And the way that that was done, the way that that $150 million was distributed, was by leveraging the burn-jag formula, which you are probably all familiar with, and by utilizing the state administering agencies, or the SAAs, using their offices and their position to push the money out to the localities. The recognition on the Department of Justice side was really the most efficient and effective and flexible way to get the money out into the localities where it is needed for a whole number of purposes that I'll talk about in a minute. But I can tell you, as kind of the folks that have kind of been on the front end of it, kind of helping the SAAs understand and implement it, I can tell you that the Department of Justice was quite magnificent in just how quickly they did get the funding out, how quickly they approved the applications, how quickly the money was sent out. It really, really was an impressive effort by the government. $850 million, believe it or not, is not that easy to move, but the Department of Justice and BJA in particular did a fantastic job, and we were really happy and proud to be part of that effort. So let me give you a little bit of an idea of the language of the CESF that kind of goes into what some of the allowable expenses or applications are for. So the funds awarded under the CESF program must be utilized, again, to prevent, prepare for, or respond to the coronavirus. Allowable projects and purchases include, but are not limited to, overtime, equipment, including law enforcement and medical personnel, protective equipment, hiring supplies such as gloves, masks, sanitizer, training, travel expenses, particularly related to the distribution of the resources impacted by the most impacted areas, and addressing the medical needs of inmates in state, local, and tribal prisons, jails, and detention centers. Now, as part of this, what we realized is that technologies that facilitate monitoring of early releasees as a result of coronavirus is also one of the applicable expenses that CESF funds can be used for. And one of the things that we've tried to do from the beginning of the CEFS program is to help work with agencies and with state and with SAAs to talk about the importance of ensuring that we're preparing for collateral consequences down the line. So while the applications were due in a while ago, a couple of months ago, and while the money has been distributed to the localities for the most part and to the SAAs, there is money that can be applied for in many of the SAA's offices already because of the recognition that we need to kind of spread the value of that funding out over the 2 years because of continued issues that will arise. So that being said, let me suggest to you, folks who are on the phone or on the webinar who may not know who your SAA is, feel free to visit the NCJA website so that you can identify in the individual state who the SAAs are, what their offices are, and you can begin to have a discussion to see if there are some possibilities in that particular state. At the end of the webinar today, not only will that website be available to you, but also a much more detailed webinar is on our website specifically on CESF, just in case this abbreviated version is not enough for you and you'd like to find out more about it. So with that, Let me go ahead and now turn it over to Joe, who will give us an overview of the technology and the smartphone apps that can be used for these purposes. So Joe, go ahead and take it away.
Thank you, Chris. Can you all see my screen? Yes, thumbs up. Awesome. So these are certainly interesting times. Obviously, community supervision is highly challenging, even in normal conditions, right? But when you add the pandemic on top of it, and the challenge of having to provide quality community supervision services in a socially distancing world, it can seem pretty daunting. The economist Milton Friedman has a great quote. He says that only a crisis, real or perceived, produces real change. Well, clearly we're in crisis mode right now. We're knee deep in crisis. And so too, we have opportunities for change. Out of necessity, we must rely on technology to support community supervision agencies so that we can continue to provide quality services that we've been doing over the last several decades. But as Chris mentioned, as the dynamic is changing, as we're thinking about releasing more inmates from incarceration earlier, community supervision is going to be leaned on that much more heavily. Telesupervision or remote supervision, whatever you want to call it, is not a new concept. It's been around for decades. Several agencies have embraced this, but the current climate is forcing the rest of agencies to kind of take another look at technology and how it can support operations. So the pandemic, in a lot of respects, is simply accelerating how agencies look at technology to bolster their services and provide greater community supervision to the public. So just to give you an idea of the landscape of telesupervision or remote supervision, again, as I mentioned, not new, not remotely new. I've tried to organize some of these technologies in buckets, starting at the far left, location-based technologies. The earliest RF systems that were house arrest based, basically determining whether a client is maintaining their curfew compliance, have been around since the mid-1980s. And that was soon followed up by GPS tracking that allows us to monitor locations of offenders in the community on a 24/7 basis. Check-in systems, again, have been around for decades. The earliest system were interactive voice response systems or call-in systems. Also, automated reporting kiosks were used quite a bit. And all of these systems are still in use, by the way. But also internet reporting. There are some tools that allow clients to get online, go to a website, and do their reporting requirements via the web. So again, different ways of checking in remotely. Alcohol testing is an area that's leveraged technology, again, for decades. The home breathalyzer systems are well established. They've kind of given way in recent years to portable breathalyzers, things that are handheld, that clients can carry with them as they do their business in the community, and when prompted, can take breath samples. Interlock has been around, again, for many years for the DWI population and continues to be very relevant. All remote technologies that don't require the client to enter an office or interact with a probation officer. Continuous transdermal devices, a little bit more recent, but bracelets that are worn on the client's ankle take readings of insensible perspiration that go through the skin to detect alcohol levels on a continuous basis. Again, completely remote, completely hands-off in terms of contact with officers. More recently, I think agencies are looking at meeting and collaboration tools. And even pre-COVID, there were jurisdictions that were using FaceTime and Skype to connect with their clientele. And this was primarily in jurisdictions that maybe had a large geographic area. And they looked at these technologies as a way to communicate with their clients who maybe live in the more remote or rural areas of their jurisdiction. Some counties are several hundred miles in scope. So it can be very difficult for clients to get to probation offices and vice versa, the officer to get out to the field. And so these agencies were leveraging these tools to make those connections. Group sessions, there are some jurisdictions that were leveraging, Nebraska comes to mind, leveraging their internal telemedicine infrastructure to deliver anger management and other skills training to groups of offenders in common locations, for example, sheriff's departments in different parts of the state, so that they can attend those as a group and not have to all commute several hours to a large city, for example. So those are pretty well established as well. More recently, we're looking to Zoom and WebEx and things like we're doing today to interact and do court sessions. Virtual drug court is becoming a thing. And so it's really the direction of the future, but at the same time, there's nothing new here. Well-established remote telesupervision technologies have been used for decades, and I'm hoping that the COVID epidemic will help show us that these technologies can be incorporated in a responsible way, an effective way, and have legs well beyond the COVID pandemic. So one of the areas that I'm particularly excited about are smartphone applications, because in part they capture or they address a lot of these existing issues. In some way, shape, or form, they can address location, check-ins, alcohol testing, and, as well as meeting and collaboration. So what are smartphone applications? Essentially, they're specialized case management and monitoring tools developed for community supervision purposes. They're typically downloaded on the offender's smartphone or one that can be provided to them. And in that way, the officer can communicate with the client, support the client, connect with the client, and maintain awareness of activities remotely without having the client come into probation offices. So the reason for smartphone applications gaining traction, I believe, are kind of twofold. It's really a combination of the power of the smartphone as a tool combined with ubiquity, right? So we all know that the smartphones that we carry around with us are far more powerful than the computers that sent folks to the moon back in the 60s, right? It's incredible when you think about the power that we're carrying around in our pockets, particularly when you contrast it to a GPS device or a breathalyzer, something that's relatively dumb, right, in quotes, in terms of its capabilities. So that's a big feature. Obviously, it's internet enabled. We're able to access the world at our fingertips. Location awareness is built in, it's native through GPS chips, through Wi-Fi location services, through cell tower triangulation techniques. Obviously, wireless data, we are able to transmit messages, emails, documents seamlessly, easily, without much effort at all. The video capabilities are very important. The ability to do FaceTime, video chats, video recordings, group conferences can't be overstated. And peripherals, and I'll talk a little bit more about this later, but the ability of these smartphones to connect with external devices, it expands the capacity of these devices, of the smartphones, in ways that, that we're still learning, I think. The other aspect or major issue here is ubiquity, right? Almost everyone owns a smartphone. 81% of US adults own smartphones, and not surprisingly, that number is skewed when you talk about younger populations. And anecdotally, the agencies I've talked to, report that even the most indigent of clients somehow manage to have a smartphone and manage to have, a data plan of some type. And for those who don't have that, again, the vendor products either provide phones or there are programs that provide phones for client use. So the combination of ubiquity and power are really exciting in terms of a tool for community supervision. So general functionality of these tools, and these are just kind of possibilities. Not every product can do every one of these elements. Not everyone does it to the same extent. So I try to focus this talk more in terms of functionality versus product centered. But as we discussed, remote check-ins, right? The ability to check in with clients and get basic information. Have you changed your address? Have you been contacted by law enforcement? Are you employed? Has that changed at all? That all can be done via the smartphone, and it can be done on demand. The officer can ping the client and ask for a response at that point. It could be scheduled, it could be random. In some cases, some apps allow it to be client initiated. So if the client wants to proactively let the officer know that, hey, I lost my job today, they can do so. Location tracking is one powerful aspect of it. This is kind of divided in two approaches. One is periodic or point-in-time checks versus continuous checking. Periodic checking just means that you're checking into the officer or to the app and documenting your GPS point at that point in time. And typically that location point is connected to the client via some kind of biometric or a PIN or something of that nature that basically connects the individual to the phone at the time the GPS point was collected. The other approach is more of a continuous approach. It's more akin to a traditional two-piece GPS device where it's tethered to the client via RF or Bluetooth bracelet that makes sure that the smartphone is in proximity to the individual client throughout the day, so that the data points that are collected are associated with that individual. One of the key features that almost all apps have are calendar reminders, right? We know that our clients lead chaotic lives. They don't always meet their obligations, but very often simple reminders are effective in reducing failure to appear. So these apps allow for the structure to create calendars and push reminders to clients about important events like court dates. Some apps also provide a platform for pro-social network support. So if a client has some people in their lives who are engaged and invested in their success, these other folks can have access to calendars so they know that Johnny has a court date next Thursday and they can help keep that client on track, which is pretty powerful. I mentioned peripherals. One of the peripherals is a portable breathalyzer. Some apps are connected with the breathalyzer, so the breath sample is taken, is documented via the smartphone's video capabilities, and results are transmitted. We know that positive reinforcements are important. Evidence-based practices tells us that. And some of these apps have the capability to generate automatic praise or attaboys, acknowledging when the client is doing the right thing or a pattern or behavior emerges that is positive. Some apps include gamification. So depending on whatever parameters are set, the client can earn points for making curfew every day this week or going to his job on time every day this week. And then they can redeem points, for example, for a coupon or a gift certificate to a supermarket or to buy groceries or something of that nature. We also know that a lot of our clients don't just deal with probation and parole, they deal with social services, child welfare. Some of these apps offer a HIPAA-compliant platform for cross-agency information sharing. And so it really helps with continuity of care. Multiple agencies are looking at the same information, get the same information at the same time. Document management is an aspect that some apps offer as well. So consider the ability to send your client the conditions of supervision via the app, and they can refer to that at any time. Working the other way around, the client can take a picture of his pay stub or her pay stub and upload that to the supervision officer so that the documentation is fairly automated, doesn't require a visit to the office and time down from work to get to the office and so on. Again, the video aspects can't be overstated. The ability to do a video chat with an officer at any time, really on demand, for treatment sessions or group sessions. Virtual home visits can be done. You can ask your client to, during a video chat to look at the refrigerator and open up the refrigerator. Show me what's inside. Is there alcohol in there? Show me your dining room table or your coffee table. Is there anything in plain sight that might be an issue? So different ways of using the video aspect that creative officers can really kind of go wild with. Program delivery. We can use smartphone apps. A lot of applications are allowing access to online cognitive-based treatment approaches, recovery support tools, various interventions that help the offender stay on track. In the substance abuse and mental health world, specific apps have been developed for recovery support. And so some of these criminal justice apps are leveraging that work that's been done. So quickly, benefits, obviously increased communication and connection with our clientele. That's ever more important in a COVID age where people are isolated and disconnected. The ability to have this instant connection and communication tool is even more important. Some agencies report that they have better communications with their clients than they did face-to-face, which was interesting. They find that the clients are more open, more willing to share electronically, and maybe that has to do with disinhibition with electronic means versus a direct confrontational perceived confrontational interaction with an officer face-to-face. So certainly something of worth further look and further study. Can be a great force multiplier. It's a more efficient method of communicating with clients. You don't have to wait around for the client to come in, missed appointments, missed connections. Theoretically, you can send broadcast emails to your entire caseload or messages to your entire caseload on this system if a new job opportunity or something of that nature came up. From what I understand, most applications are pretty quick to ramp up. There's not a lot of lead time necessary to get these going, and they're fairly cost effective. Some of the apps can be as low as less than $1 a day. Others can be up to $2 a day. But we know the COVID situation is going to have an impact on budgets, state and local budgets moving forward, and hopefully some of these monies will help offset that. But it's certainly important to look at how technologies can deliver services more effectively and efficiently moving forward. Smartphone apps should be a bit more future-proof than some of the other built-for-purpose corrections technology, where a lot of R&D effort and monies went into developing a product. So vendors may not be as willing to update things as they go along. A lot of the market, this is essentially a consumer-driven market, the smartphone market. So a lot of the improvements that are going to be occurring in the larger marketplace will benefit community supervision moving forward. For example, Samsung has a patent for a smartphone that has a built-in breathalyzer. So you wouldn't need two separate devices if that ever comes to market. The last thing I want to talk about in terms of benefits is an example of one app that's being used in the Utah Department of Corrections. So they're using this app, and it's traditionally designed to be operated via the smartphone, but it could be operated on a tablet, for example. And so that's exactly what Utah is doing. They're allowing inmates access to the application via inmate tablets. And so they're starting their reentry process, looking at resources, maybe doing some preliminary job searches via the application. And then when they're released to community supervision, they have access to the same app just on a smartphone. So they're able to continue continuity of using that resource throughout the process of supervision. This is a little sampling of vendors, not an exhaustive list by any means, and certainly not endorsements of any particular company. It really just put this up there to show how broad the market is, and it's growing rapidly. It seems to be new companies seem to be emerging every few months. So it's something that the vendor side is keeping track of as well and looking to fill a niche. Finally, resources. APPA put out an issue paper in April on this particular topic, and the idea was to inform and educate the public about the technology, what the capabilities and limitations are, and more importantly, what the operational implications and things that agencies would consider as they can move forward in this approach, if that made sense for their particular agency. Thank you, Chris.
Thank you, Joe. We really appreciate it. So now let's turn it over to Lisa, and let's get the practitioner perspective, if you will, and what it's like to use these technologies as boots on the ground.
Thank you, Chris, and thank you, NCJA, for allowing this opportunity to speak to everybody about really what this looks like. So, you know, we contract with the Federal Bureau of Prisons, and we just came out of a 10-year contract where technology was really forbidden. Residents under that contract, you know, again, 13 years ago, really had to get special permission even to use a cell phone for work purposes. And so here we are today under this new contract where in the new statement of work with the Bureau of Prisons, GPS was a requirement for a certain portion of our population. So we went from just having a few people on GPS to now really the Bureau not only accepting technology, but we are really embracing it and relying on accounting for the clients that are in our program. So our world has changed dramatically. So our new contract started in October, and we secured a provider, and we learned about location monitoring via GPS with smartphones, because smartphones are now allowed with this contract. All of our clients can have smartphones, and also continuous tracking, as Joe mentioned. And so, you know, unbeknownst to us back in October, we were just so happy and ready to enter into the 21st century. And then bam, come March, our world changed, and we had to quickly start embracing and become experts with our new system, as did our residents. They didn't have a choice. The train was moving and they needed to hop on. So as you can imagine, it really was an uphill battle where, you know, you have residents in your facility that, number one, have never probably even used a smartphone, are seeing a smartphone, but now they have to figure out how to upload the app, how to use it. So it was a learning process, but our residents really embraced it as well. Before smartphone technology, the way we would account for residents is they would call into our facility. All of our facilities had caller ID, and we would gauge their whereabouts by the number that they're calling from. So there's a lot of pros and cons with that, right? You can spoof numbers, you can call and then leave. So with the smartphone technology and the app and the continuous location monitoring, all of that went away. And it really provided a lot of relief for our clients, because if they went somewhere and the location didn't have a phone for them to use, or they didn't have a pay phone and we didn't hear from them, well, in our world, escape procedures begin. And, but they're not really on escape. They just don't have access to a phone. So now, again, with the smartphone technology, they're able to let us know what's happening. We trust them, and then we verify, right? So we'll let them know, Mr. So-and-so, thank you for calling. I'm going to send you a check-in, complete it so we can ascertain your whereabouts. And, they comply. So it's really given them a lot of, taken away a lot of the obstacles that they were facing when they were in the community job searching, or maybe at work late, that they had before. So with COVID, the pandemic, yeah, it's, innovation out of necessity, right? So we had to figure out how we're going to account for all the individuals that are transitioning from federal prisons into settings like ours, because as we all know, they released a number of federal inmates into RRCs. And so our contract only allowed for 40 individuals on home confinement. And our highest number to date has been about 103 individuals on home confinement. So it really has helped us in ensuring that we're meeting our contractual obligations, that the clients are where they're supposed to be. And the beauty of it really is that you can design a program based on somebody's risk level. If somebody is very, very, very high risk, we're probably going to exercise the option of putting an ankle monitor on him or her, so that you have the continuous, as Joe mentioned, you have the continuous monitoring of their whereabouts. You create a zone and you get an alert the moment they step out of that zone. The location monitoring, again, it's where you send them a check-in, or you give them times to check in, and their movement is reconciled at the point of that check-in. And you can schedule one a day if somebody's really low risk, or you can schedule 24 a day and have them check in every hour on the hour. So it gives us a lot of flexibility, and it gives the clients the ability to be responsible. The other really dynamic part of it, and the beautiful part of it, I love this stuff, if you can tell, because it gives you so much creativity, and it really gives the clients, our residents, ownership. Because if you have somebody on an ankle monitor, let's just say that they're compliant for 30 days. As Chris stated, positive reinforcement of those attaboys is so important. Just like for those of us that have kids, right? We all know that timeout doesn't always work for them. At least for my kids, timeout didn't work. It's that positive reinforcement that solicits, change in behavior. So if somebody's doing really well, we'll take them off the ankle monitor. Let's go to that check-in app and maybe start off with 10 check-ins a day. Okay, you're doing great. Let's go down to 5. Let's now go down to 1. And it works both sides of that coin, because if somebody is not compliant with their check-ins, guess what? You're now on an ankle monitor, and you have to prove you're compliant with that. So it's just been a very, very interesting time for us navigating through these obstacles. And the weird part of it too is the clients don't ever get a message on their end that their check-in has been completed with us, or that we approved it. And they'll call us back and they'll just, say, did my check-in go through? I just want to make sure, I'm in compliance. And so we really reward them for that as well, because not everybody does that. And we actually shared that with our provider, and they're looking at creating something so that clients do get, a completed check-in on their end, so that they have peace of mind as well. So we haven't had the good fortune of using it a whole lot with movement and such because we've been on lockdown really since March. But we're able to see them virtually, and we also are required to go out to their home even now with the pandemic, even here in Texas when things are just kind of spreading. But we still see them in person, but we're also connecting with them virtually. So it really does foster good relationship building, good communication. The other really interesting part of this too is we have people that are sent to us that are direct home confinement cases. So they'll come to our facility and they'll be here maybe 10 minutes for us to do an intake, and then they go home. They go on home confinement. So we don't know anything about them. So we really rely on the Zoom, seeing them face to face, to build that connection and that relationship with, with trying to keep everybody safe. So that's it.
Thank you. Thank you, Lisa. That's really interesting. So a couple of questions for you both. First of all, Lisa, you talked about the ankle monitoring, and both as an incentive to get off it, but also as almost a reprimand if you have to get back on it. Do you ever see smartphone apps replacing, and I'll refer to that as traditional monitoring. Do you see smartphone apps replacing traditional monitoring, electronic monitoring, I should say?
Versus the continuous monitoring?
Yeah, the cell phone apps versus traditional electronic continuous monitoring, yeah.
I mean, it possibly could. It's just, right now, it really, like with us, if you have somebody that is just, we use the ORAS risk and assessment system, and that measures the risk of recidivism and their criminogenic needs. You are going to have individuals that you want to make sure they are where they're supposed to be every single minute of every single day. So I don't see it going away entirely, but I could see it more as an option for you to give that positive reinforcement for those that are doing what they're supposed to do and rewarding them. Did they answer your question?
Yeah. Joe, do you have any thoughts on that?
Yeah, I think I would agree. I think for high risk clientele, the traditional GPS bracelets are not going anywhere, that they're probably the best tool for purpose. We know that no technology is perfect. Every technology can be circumvented, but we know a lot more about how GPS can be circumvented than we do about cell phones, for example, or smartphone. So I think we need more research in terms of the vulnerabilities that are unique to the smartphone applications, even though they're tethered. They're a slightly different animal. So I think we need to know more about what the gaps are.
Even now with the location monitoring, if I can just hop on that, we do have individuals that really try to bust the system. They think they're really, really bright. And, so what we see is we look for patterns. So when we do a check-in, if it goes more than 5 minutes that they've responded, something is wrong there, right? None of us live in a mansion. It shouldn't take you 30 minutes to cross, the hall to do your check-in. You hear it, you check in. So if you have somebody that is constantly 10, 20, 30 minutes behind doing your check-in, then you have to start taking action. Pull them in, put them on an ankle monitor, just take some kind of an action. So believe me, we've only been in this world for about 5 months, but I feel like I've seen everything that possibly can be done.
Oh, I bet you'll find more things.
Yeah.
I know it feels that way, but I bet. A thought struck me as you were talking, and it kind of goes to, I guess, the extent to which these technologies make life a little bit easier for your clients in certain regards. But is there an argument kind of on the other side of the fence that says, no, but wait a minute, you know what? Having to schedule yourself in time so you show up for a meeting at the probation office, and that you manage the the public transportation system, and that's skill development in and of itself, right? Those are important skills and an important part of an individual's reintegration. Is there a thought to that idea? And is there a way to kind of compensate, I guess, for the skill building so that it just quite frankly doesn't become too easy to be monitored? Does that question make sense at all? Maybe not.
I'm trying. I'm trying to follow you. Yeah.
I think, yeah, I'll jump in. I think that what you're talking about is kind of the benefits of accountability and structure. And I think that there's benefits that are kind of inherent just being on monitoring, not necessarily having to report to the probation office and what that all entails. Personally, I would much rather see that effort, that planning, that organization go towards getting to work or getting to school and not necessarily getting to the probation department. If it's a low enough risk case where you can handle it remotely.
So that answers my question. There are other ways, there are other things to look to for the kinds of activities that electronic monitoring and smartphones may make easier. We can still find other avenues to make sure that those other skills are being developed. Because part of my thought process here is just from a cost-benefit analysis and making sure that that as state budgets get smaller and smaller, that the argument is continued for the electronic monitoring. A kind of corollary to that idea on the cost-benefit analysis. Is it a function of some of these technologies to effectively capture data and matrices that allow us to better analyze and more quickly analyze the success that you're having with them? So in other words, in the future, when states are looking at where they're going to put money into going back to housing people in facilities as much as we used to, or we're going to put money into technologies. Are the technologies going to help us with that kind of analysis?
So I can take a stab at that. So that's a really, really great question. Obviously for us, for our funder, the most important aspect of the program is accountability. So I was sharing with you yesterday that we have audits by the Bureau of Prisons 4 times a year. And one of the things they ask us is really how accountable was somebody? What were the infractions? And so at a click of a button, our provider was able to just give us a report and spit that out. I am also interested in looking at the transition pieces, the case management piece, you know, how did, like we can upload resources and provide a resource list to the residents. We can upload employers that are actively hiring. You know, looking at how effective were those resources? How often did he go out job searching? So for us, we not only have an internal database, but the provider that we have, we're inching toward that so that we can start capturing those kinds of metrics, because that's very, you know, very important to see exactly how this technology supported their overall transition.
Yeah, if I could hop onto that, I think obviously there's potential to use that data to you know, determine outcomes, to determine how to fine-tune programs, to determine, you know, what are the predicates of success or failures, for example. I'm skeptical because that's another step that often we don't take, right? We're so busy implementing programs that we don't necessarily take the next step of analyzing, fine-tuning, figuring it out, adapting. So for example, we've been using GPS technology for over 20 years, but we still haven't maximized all of that research. Think about how many GPS location data points we have of the thousands of offenders and the thousands of points every day, and how what research tells us about patterns of life and what that means to like the criminal path. We haven't really connected, you know, movement patterns or anomalies to patterns as a predictor, for example, of whether someone is on the track to success or failure. And it's not for lack of data, because the data is there. So The potential, to answer your question, Chris, potentially, absolutely. The next step is the important one, is putting that to making it actionable.
And are these are most of these technologies fairly siloed, or is there, and at least it sounds like there's a little bit of connectivity to case management on your side, but it seems to me, and again, a corollary to this broader data question is there a connectivity between the technologies and the case management systems and the court systems, et cetera? Or have they not, either from a technology standpoint, not made those connections, or it's also a lot of permissions that you have to get from a lot of different areas?
Right, so right now we're using 3 different systems. One of our systems is really just focused on the case management piece. We just introduced, just a couple of months ago, a section or a part of the application where a resident can submit a pass, wherever they want to go, whether it's medical. We did open up job searching for a couple of weeks here in San Antonio, so if they wanted to go job searching, they were able to submit that. And it really helped us as staff, because you don't have the problem of losing paper, but you have a track of the communication, and you can tell when the client submitted it. You can vet it, on your computer, and you can approve it. So I want to slowly enter into that world of just kind of putting everything into one application. And we have talked to our different providers to see if they can integrate the system somehow, rather than having this duplication of efforts, because I didn't want to do that. I didn't want to have us, having a lot of duplicity. So we're not there yet, but I'm hoping that we will get there.
Okay. So one question has come up in the question and answer section. Is there an applicability, and if so, how does it differentiate use of technology when supervising sex offenders, sex trafficking offenses, things like that?
Crosspoint doesn't supervise individuals convicted of sexual offenses or individuals convicted of murder. So I couldn't really speak to that. I'm not sure if Joe could.
I think, regardless of what the type of offender is, I mean, you incorporate the technology as part of a larger case management plan. So it's part of a larger strategy. Tying it back to remote or telesupervision. I didn't mention this in kind of my bucket chart, but we've had tools that can remotely monitor computer use, tablet use, phone use. That specifically relates to sex offender management and kind of the containment model. So that might be a potential application. But in terms of like the smartphone itself, I mean, there might be different types of questions, different focuses. You might be you may want to use continuous tracking, because inclusion zones and exclusion zones are going to be that much more important with a sex offender. And periodic checks are not going to cut it as far as an exclusion zone or an inclusion zone. So that would kind of be how that might be handled differently.
Great. Thank you. So we're running towards the end of our session. We've got one more question, but before that, I'm going to ask. We're going to open up for a short poll. So please let us know what you think about the webinar. So there it is. It just popped up on my screen. But while that's there, let me kind of ask one final question that kind of goes to the issue of scaling up, and if a state, if in a particular state, this is done by one agency or one local government, what considerations do you think carry into another agency or population as to whether or not to participate in something like this?
Do you want me to start?
I think Joe might be filling out the survey.
The survey? Well, I think number one, you have to really be willing to dedicate some time and energy to teaching your clients about technology. And it's really time consuming. They have a lot of questions. And so just bringing them into the 21st century and teaching them, it's really, really important. The other thing is, just like when we see with each other in email, you know, like I can be in the same building with somebody and they'll send me an email and I'm thinking, why didn't you just come down the hallway and just, you know, tell me that? And then maybe I didn't receive it the way that they intended for me to receive it. And so, you know, I could be thinking about it and taking it wrong. So technology is it only takes you so far. It doesn't replace that connection that you have to build with the individual, right? You have to want to help them and they have to feel that you want to help them, right? You're creating that partnership. So if we're thinking this is going to replace all kinds of communication, no, it's not. It could easily backfire.
Hopefully technology enables us to be more human with each other and be better humans with each other.
I think Chris, I think that the main challenge, I think, for agencies is to figure out how to best apply this amongst their caseload. So one of my worries is that, you know, we often have a fascination with technology, right? If it's new and it's glitzy and shiny, we want to use it and we want to apply it across the board, right? More is better. But we know that with low risk offenders, very often doing nothing is the best option, right? So even something that we might give them with the best intentions of supporting and connecting, if we're not using it in the right way, could have negative consequences. So I would be all for giving or putting low risk clients on a smartphone application, provided they're not dinged if they don't comply, right? So if we use it to strictly support and connect, but don't make it a compliance issue, then I would be completely for that. But if it becomes a pitfall or a potential you know, way to to get into trouble, for example, then I think that there's a potential for net widening on that aspect. On the other side of the spectrum, obviously this would not be your primary supervision method for high risk offenders, but it could augment your traditional methods as well. So kind of picking the right populations and then how to apply it within those populations, I think is critical. It's not an across the board kind of thing.
We've had one more question come in, and since we've got a couple more minutes, I'd like to make sure we get to that. The question really centers around staffing and whether or not you see the incremental increase in the utilization of technology as ultimately allowing for or encouraging the decreasing of staffing, or if it's simply a matter of utilizing staffing in a different way.
For me, it's really utilizing staff in a different way. I haven't yet seen the use for cutting staff back or, you know, decreasing our staffing pattern at all. As a matter of fact, we saw the opposite, because keep in mind, before we just had, you know, 30 people to check on. Now you have up to 100 people to check on. So it went from a task that was maybe, you know, an hour to a couple of hours, maybe even past that, because you're checking up on violations and you just want that certainty. So I haven't seen that.
Yeah, I would agree. The technology is really ideally used to make folks more effective and more efficient, and ideally to reallocate your limited resources towards those higher risk offenders who need that intensive personal interaction. So the more of the low risk offenders we can deal with technology, frees up resources for the intense personal services for the higher risks.
Well, I think that's a really, really important point to keep in mind. Again, going back to that issue of the difficult position budgets are going to be in, state budgets are going to be in the future, and not letting funding agencies get away with that argument, right? Not you know, kind of proactively going up against that argument and saying, just because we're using this cool, you know, new technology doesn't mean you need less of us. Our workload is higher. It's enabling us to deal with that workload, but don't think for a second that we need fewer people. And I think that's really important for folks to keep in mind as we're looking towards the future. Well,
I think the false premise with that argument is that agencies were ever adequately funded to begin with.
Fair enough.
So I don't think that was ever the case. So, you know, yeah, you can't start from that point.
Certainly. Well, listen, thank you, Joe and Lisa. Thank you so much for your expertise and for the information today. Thank you to everybody else who is on the webinar today. Again, you can see on our website a number of different webinars that will explain both the CESF as well as who your SAAs are and some other information, COVID-related information. So please utilize that. Give us a call, send us an email if you feel like there's anything that we can do for you folks. Be more than happy to help in any regard that we can. Again, stay safe, stay well. Thank you very much, everybody, for joining us. We'll see you next time. Thanks.
Thank you.